insurance, I don't understand. What's not to understand? It's not covered on your insurance. They're not paying for it. It's very simple.
Okay, the hour's late, and I'm going to talk about medical guidelines. Now, I've asked this question before. Before you heard this title, how many people here ever heard the expression medical guidelines? Please raise your hands. Okay, that's more than I usually get in the way of percentage-wise. Medical guidelines are important. The expression did not exist until 1984. There are two kinds of guidelines. There are preventive guidelines and therapeutic guidelines. And I'm going to, again, my object today, and I ask you each to take something to write on, because I've given papers out talking about U.S. preventive guidelines, not much about therapeutic guidelines. I'm going to tell you where to look online properly to find these things. It's very important that you do this yourself, and please do not come up with any personal questions while I'm speaking. You can ask general ones. I'll be glad to answer them gladly. The word guidelines medical guidelines was invented in 1984, went through an act of Congress. The United States Preventive Services Task Force was formed. That's USPS, as in U.S. Postal Service, TF, Task Force. Write down those letters, USPS, TF, put it into your computer, and you will get everything you want to know about preventive task force things. The first thing you'll see when you enter it is Amazon. But right after that is the real stuff. Understand, that's a fact. Now, what are these things and what is the USPSTF? Okay, the USPSTF consists of 16 people. That's it, running medicine in this country. And believe me, their power is incredible, and it's going to become more and more and more. These 16 people, and I actually looked at each of their biographies, are all academic physicians, except for one nurse, who happens to be the chief of nursing services at Yale New Haven. The others are all professors of medicine or pediatrics or preventive medicine at quality first-class medical schools. They are appointed by another organization, which is a government organization, which is called the AHRQ, or the Agency for Healthcare Research and Quality. The Preventive Service Task Force was started in 1984. The AHRQ was started in 1998. These things are relatively new. Everything that they do is based on evidence-based medicine. That's an expression each of you should know. Evidence-based medicine is not what your grandmother told you was good, hot, or cold. This is stuff that is being done in academic medical centers where they do controlled studies, where people get real medicine, they get placebos, they get real medicine A compared to real medicine B, and so on. And no study is really acceptable unless it's been controlled under these circumstances. What your Bubba told you is a Bubba Meiser, and what you hear from a lot of people is a Bubba Meiser, and three-quarters of the stuff you see on the internet is really not true. Preventive services. When they talk about preventive services, and this is on the sheets that I gave you, and which most of you I hope picked up, there are three sheets that talk about what the USPSTF has analyzed and so on. If I can find it, I'll be in good shape. Okay. There are three sheets talking about what they have studied. And you'd be shocked at some of the things they have studied. I mean, you look at some of the things, screening for glaucoma, okay, that's important. Screening for prostate cancer, that's another one. These are things that they have reported about. They grade everything that they report about on a scale that says A, B, C, D, or I. What does A mean? A means that the evidence is overwhelming that their recommendation is important to your health. No questions asked. B means that the evidence is very, very good that what they're recommending is good, or for that matter, bad for your health. But it is not as strong as an A recommendation. And there are sheets out there that have, I wish I had another hand for this right now. There are sheets out there that you should have picked up that have all of the A and B recommendations that they have made in the last 30 years. There aren't too many of them, if you notice. And I'll get to those in a moment. The C recommendation means the evidence is not very good that what is being proposed is good for you, but there isn't any harm to it, and you and your doctor have to decide whether or not this might be something that you can do. We're talking here about medications, tests, and so on. A D recommendation means there's absolutely no evidence that what is being proposed is good for you. It should never or almost never be done. And you'll find in some of the D recommendations things that you have been asked to do, or asked to take. And I means there is incomplete evidence as to whether this is good for you or not. And it is really important, every time you are asked, when you go to your physician, whether to do something, to see whether the USPSTF has recommended any of these things, and be very, very wary if they're C, and particularly if they're D guidelines. Here's the sheet with the USPSTF A and B recommendations. There are two sheets. Here's one of them. Most of them, if you look down the column, the next to last column, are B recommendations. There are very, very, very few A recommendations. Here's one, colorectal cancer screening. They recommend screening for colorectal cancer starting at age 50 and continuing until age 75. What does that mean? That means they do not recommend it before that. Actually, it's a C recommendation, before 50 and after 75, depending on various other factors. Another A recommendation, folic acid supplementation in all women who are pregnant or planning on pregnancy. Simple, folic acid, it's cheap and so on. But that's one of the few things that really shows up. You should screen for hemoglobinopathies in newborns, particularly if you're not Caucasian, and so on. Now, the very top one of these things in this sheet says abdominal aortic aneurysm screening, men. The USPSTF recommends one-time screening for abdominal aortic aneurysm by ultrasonography, not CAT scan, in men ages 65 to 75, and not under 65, who have ever smoked. There is more than one organization, one of which is based in this community, where they send you letters every once in a while saying you must go and get yourself an abdominal aneurysm screening, and while you're there, get a carotid aneurysm screening. These tests make a lot of money for the people that do them and are totally, totally useless unless you've been a smoker. Yes, ma'am.
I have two questions on that. On the USPSTF A and B recommendation form,
Yeah.
the grade where they have A and B is the A and B recommendations that you defined a moment ago?
Yes.
Okay. That one is the one that says abdominal aortic aneurysm screening for men. On the published recommendation sheet, abdominal aortic screening, it's the same date, June 2014. It says adult senior. It isn't gender specific.
Yeah.
Which one is it?
It's, the recommendation for the B is on the sheet with that.
It's the
That,
men.
the other one you're looking at has things that have been recommended, and the recommendation for that is probably a C or a D, depending on age and so on. In other words, there are three sheets full of what they have screened for and what they have recommended, and 1.5 sheets on what they've given A's and B's. There are a lot of things they have on that original list with the 3 pages, one front and back, and flip it over.
Right, that one.
Yeah, many of those things are C recommendations. They just show that they have made recommendations. It doesn't say positive or negative.
All right, gotcha.
Okay? I should have made that clearer.
Many of these recommendations stop at 75. Why?
See, why? They stop at 75 because when they're made, and again, anything that stops at 75 has a C where there's an elective. The assumption being made is that after 75, the testing will be less positive and will cause more problems than not doing the testing. Their bottom line is when you're 75, they expect you to have 10 more years of life in front of you. If you're perfectly healthy and have been a smoker at 75, which is rare enough, let's say colon cancer screening or mammography. When you get to be 75 and you've had negative mammographies every year or every other year, and that's another one, that question, all those years, when you get to 75, they do not recommend getting further breast cancer screening or mammography or getting further colonoscopies, with one exception. If you've never had a colonoscopy, then they recommend you're getting one. Colonoscopy should be done every 10 years. How often mammography should be done is a wide open question at this point. Every year, too much unless you have a family history. Yes, sir.
I think I saw today that some guidelines came out lowering.
Hypertension, yeah. I want to get to that in a moment. That is a therapeutic recommendation and not a preventive one, and I'm going to get to those a little later. Now, the only people authorized to make these preventive things and call them preventive is the USPSTF. Nobody else can go out there and say, we want to do this preventively and get the approval of the government. And the government has a law. This is part of the ACA, the Affordable Care Act, one of the better parts of the ACA. If there is an A or B recommendation and you want that done and your doctor says you don't need it, or your insurance company says, I won't pay for it, you may insist that you get it done, and your insurance company must pay for any A or B recommendation that you get. If you are, just again, colonoscopy, you're 55 years old, your insurance company says they will not pay for it, they have to pay for it, no matter what your insurance is, whether it's the best golden plan from Aetna or United Health or Medicaid, they have to pay for it. Prior authorization, I'm going to pass through that now too. Quickly, there is prior authorization for many procedures that you do, and I'm not going to get into them specifically. But most of the time, no matter what your insurance is, if your doctor wants you to get an MRI or another expensive kind of procedure, you will need to get prior authorization. Your doctor, the person recommending it, has to get this. Very often the radiologist who is doing the procedure has to get it. This is going to get stiffer and stiffer and more regulated as we go along. And Medicare, which has been the only institution, plain Medicare, not managed care Medicare, which has been the only institution that doesn't require priors for anything, is starting them electively next year in 2018. They will be required in 2019, unless that's delayed by a law that's sitting in front of Congress right now, which is being fought about furiously by insurance companies and consumers, as to whether priors are going to be needed for things like MRIs and various operations and so on before 2019 or 2020. It's really interesting.
That's traditional Medicare?
Traditional Medicare, the only one that does not require any priors of any kind at this time. Now, that doesn't include Part D for medication, but we're talking about procedures, both surgical and diagnostic. Okay, now, so again, take those, and I hate to, I'm sorry to confuse, the ones without the A's and B's on them, look at those. If you see anything on there that has been recommended to you, and you don't want to do it, look it up and see what it says. Now, these are only for primary care. The USPSTF does not consider things that are done by specialists. And in other words, they don't talk about things like angiograms and stuff like that. And they in the AHRQ report to Congress every year. God knows what happens there. And they make recommendation, and they publish everything online. If they are investigating anything they want to start doing, or investigating and to see whether or not they want to recommend anything, if you look it up, let's say, and right now they're actually going into studying various things for osteoporosis. They are asking you as the consumer to make recommendations to them. You have the ability to say to them, I think it wouldn't be a bad idea to do A or B or C or whatever. And they have an open thing for that. And you can, again, look that up online. If you don't have availability to line, ask your grandchildren to help you. Okay. Now, we're going to talk a little bit. By the way, the task force consults with other organizations, and I want to talk about other organizations now. Every single group of medical doctors, specialists, has one or more organizations. There's an American Heart Association. There is an Oncology Association. There's the American College of Physicians for internists. There's the American College of Pediatricians for pediatricians. And there are many, many of these. There's the American Urologic Association for urologists. There's an orthopedic association, etc., etc. These people are consulted by the USPSTF, but they also make their own recommendations. These are therapeutic, and they come out with what they call medical guidelines. And these are published usually in the specialty journals, but very often in the non-specialty journals like the New England Journal or the AMA Journal. And they make them up as they see and so on. Most of them are very reliable. But now I'm going to bring in a little bit of Gemara. What is it now that keeps the guidelines from being, real halacha, real definite rules? Because what happens is there's a lot of machlokas in this thing. Those of you who don't know what the word means, it means conflict. And you're right and you're right, but they can't get together. And the prime example of this has been how often should you get a PSA, a prostatic specific antigen, to screen, end quote, for prostate cancer. The American Urologic Association has been saying for years, you should do one on everybody over the age of 6 who's a male, not females. Well, no, realistically, anybody over the age of 40 if you're African American, or 50 if you're anything else. The American College of Physicians, on a Monday, a few years ago, that's the Internists Association, just before the AUA started their convention, said nobody should get a PSA unless you have documented prostate cancer. And then it's not diagnostic, it's really to see how you're doing. So we had a machlokas, one saying never, one saying always. 6 months later, the American Society of Oncology, which is the group of the oncologists, came out and said, Nishtahi, nishtahea, you can do what you want to do, basically. That's what we have to face. And today, I started looking for my emails early this morning, and the first thing I see on Yahoo is that the American College of Cardiology and then one of the other cardiac associations came out on their own without any cooperation from the PSTF and or anything else from the renal people who are dealing with hypertension, and said, you know, we've been telling you forever that your normal blood pressure should be less than 140 over 90. Well, we just changed our mind, and it should be, you know, we're not calling 130 over 80 pre-hypertension anymore. We're calling it hypertension. It's real high blood pressure. What they're recommending is that you basically change your lifestyle and not necessarily take medication. But they changed the rules overnight with nobody else knowing. A lot of machlokas here because I'm sure that the Kidney Society, which really is the Hypertension Society, is going to come out and say something different. Whether it's that much different or that much different, I'm not going to be able to tell you. And the USPSTF is probably going to say nothing about that. But the reality is that every single professional organization has its own rules which basically benefit their members as to what should and should not be done. Big example, orthopedic stuff. If you have arthritis in your knee, the Orthopedic Association basically says, you know, try a couple of Motrins. If that doesn't help, come on and we'll give you a shot in your knee. Whether we give you a shot of steroids, whether we give you a shot of some kind of oil, it's irrelevant. We'll give you a shot and it will help you for a month. And you'll get another one. In every paper that's come out recently, they all say basically physical therapy will help you just as much. And when that gets exhausted, when the shots get exhausted, you're going to get your knee replacement anyway. Why go through the middleman? Well, there's a lot of needles being given by orthopedists. It's very profitable. Think about that as one example as what to do. Yes, you say to yourself, yeah, I'll wait. And so I'll get this, I'll get... It may not be worth it. Now, there are guidelines for diagnosing and managing chronic obstructive lung disease. There are many for heart disease. All of them, the therapeutic ones, they basically all say, stop being fat, stop eating meat, stop eating whole milk products, eat healthy, cook like my wife does, which is a lot of fish, no fat, a lot of vegetables, and no cake and no cookies, or hardly, you know, once in a while they're good, but not too often.
Shabbos.
And Shabbos. We will not go into Shabbos.
Lord's Day Shabbos.
Friday Shabbos.
The diet on Shabbos.
Now, these things get updated periodically, and again, you know, the hour's getting late, so I don't want to go on too long, but they get updated frequently, and one of the sheets out there has some things about updating and so on. ACP updates guidelines on treating low bone density osteoporosis. Osteoporosis is a hot item. We always knew about it, but until Fosamax became available about 20 years ago, nobody had any significant kind of treatment. People would take calcium and vitamin D. They really don't help very much. And they have upgraded the treatment. There was actually a paper that came out last week that basically may change the whole treatment altogether. It's going to be studied using injectable medications rather than the oral ones at first and so on. Again, I'm not going to get very specific about that, but these things change all the time. And they will be changing all the time. Now, high blood pressure. Whether or not you choose to treat it, and let me tell you, if you do have high blood pressure, and if really it's 140 over 90, do not say to your doctor, I don't want medication, because start taking the medication. When you lose the 50 pounds, then you can start talking about going off it. But hypertension is called the silent killer for a very, very, very good reason. Get it, treat it, and so on. Hold on one second while I go through my notes here. recommendations come along that never were there before. I don't think anybody in this room smokes anymore. But there are now recommendations that are really within the last year. A lot of papers are written over the last few years concerning screening for lung cancer with low-dose CAT scan, which is really like 2-3 x-rays, it's not much. To find your lung cancers when they're that big and you can fix them before a chest x-ray picks them up when they're that big and you can't fix them anymore. And these papers were published, and the new recommendation by the task force is that those people, and if you know anybody though like this, and most of my patients have no clue about this. If you know anybody who is over 55 and less than 77, they just raised it from 74 to 77, who has smoked 30-pack years, that's 1 pack a day for 30 years, or 3 packs a day for 10 or whatever, they should get an annual low-dose CAT scan. That's a brand new recommendation. But they change all the time. Other ones are withdrawn when they're found not to be helpful. Thank you, Lynn. Okay. Now, we talked about mammography a little bit, and so on. And remember, colon cancer, lung cancer, and breast cancer are the major killers. They also recommend there is a test for ovarian cancer called a CA-125 test. There are obstetrician gynecologists who do this as a screening test. That is a recommendation. They recommend that it not be done because of problems with false positives and things that end up happening because of that. Now, if you, I told you about looking up USPSTF online and so on. If you put yourself into Google and look up medical guidelines, and then you put another word after it, you will be able to get the medical guidelines for any of that particular thing. And again, I recommend, if you have a problem, even before you see a doctor, and especially after he recommends something, go right ahead and do not hesitate 1 minute to ask him whether or not this is necessary. Now, I'm going to read something, if I can find it, and I apologize again. This all fell on the floor earlier this evening. That basically sums up the machlokes in this and so on. By the way, eventually the machlokes are going to be dissolved and we will end up with a Shulchan Aruch of medical guidelines. Okay? Someone's going to come out, and probably somebody from the government, and say, this is what should be done, and we're not paying for anything else. That's called socialized medicine, or whatever you want to call it. It's going to happen, and it's inevitable that we're going to have a single payer system. Can you have those journals in? I don't want to read this in there. Thanks.
Don't forget the selfie.
Pardon?
Don't forget the selfie.
I won't forget something. Now, just to give you an idea. Oops. If I can find it again. Because I really wanted to read that directly. I know I have it here. Recently, the American College of Physicians, the ACP, the Organization of Internists, came out with guidelines for the treatment of gout. Now, gout is, as opposed to many of the other things we've been talking about, it's like a single disease. It goes along with a lot of other things, but it's a very, very single kind of thing. And they came out with guidelines for gout that were very different than the guidelines that came out a year earlier by the American College of Rheumatology. Now, gout is a metabolic disease that is always taken care of by rheumatologists or internists. And each of them has its own organization and so on, and they all have their own recommendations how to do things. And the American College of Physicians, when they came out with their alternative recommendations, wrote an editorial explaining why they did this, and that's what I wanted to find, and I do not believe, I have about 8 copies of this thing here. I can't find one. Hold on, please, thank you. Howard, turn it over a second.